Welcome back. Now, approximately 20 million Kenyans are estimated to be at risk of or already infected with intestinal worms, a neglected tropical disease linked to poor sanitation, limited hygiene awareness, and delayed treatment. For Simon, now 10 years old, who hails from Bulanda village in Kakamega County, what began as stomach pain was fast treated as malaria. But his condition worsened. His stomach swelled. Soon, he started vomiting and passing worms, forcing doctors to recommend surgery. As Kenya steps up the fight against neglected tropical diseases, schools in Kakamega County are becoming centers of prevention, using hygiene murals and teach learners and families how simple habits can save lives. Violet Auma reports on how one child's car is exposing the hidden burden of intestinal worms in Kakamega County.
In Bulanda village, Matungu, Kakamega County, Christine Khalai still remembers the fear of June 2021. Her fourth-born child, Simon, was only 5 when he first complained of stomach pain. To Christine, it looked like malaria. She bought medicine and gave it to him, hoping he will recover. But Simon did not get better.
Kuna malaria zingine zinakuwa ati malaria za tumbo. Sasa ilikuwa inakuja kama malaria. Nampea tu dawa za malaria lakini sioni tofauti. Inapoa tu kidogo tu tena inarudi.
Days later, his stomach began to swell. The pain persisted. Kristen says some people advised her to seek help from a traditional healer, while others suspected witchcraft. But what was troubling Simon was not witchcraft, as it was later discovered. It was intestinal worms.
Kiwa umempea mtoto madawa za malaria, umempea flaji, huoni tofauti yoyote. Kwa hiyo mimi nilimbeba nikampeleka, nikijua ni ushirikina. Wakati alirudi, sasa ndio nimeshaamusha kwa sababu ule mtu akiwanga anashika hivi tumbo akifanya hivi anatoa vitu. Tapika minyoo ingine anahara. Na hizo minyoo zilikuwa mingi.
What had begun as an ordinary stomachache had become a medical emergency.
Nilifika wakati karibu wiki 3 hakuwa anaenda choo.
At the hospital, doctors found that the worms had caused serious complications. Surgery was recommended.
Walimtoa minyoo. Na hizo minyoo zilikuwa 1 meter na zilikuwa mnono. Minyoo zenye sijaiona tangu nizaliwe. Hata zenye alikuwa anatapika zilikuwa kubwa na zilikuwa hai. Lakini sikuwa nimejua tu kuna minyoo zinaweza kuwa kwa tumbo mingi mpaka ziaffect mtu aenda afanywe operation.
Today, Simon is 10 years old, but the scar on his stomach remains a painful reminder of how a disease many families dismiss can push a child to the operating table. Kristen says she spent close to 100,000 shillings on treatment and surgery, pushing the family into financial distress.
Ya kwanza tuliuza ng'ombe. Alafu sasa ya pili tukauza miti na wakanichangia zingine. Unajua wenzake mpaka wanamcheka. Babu mtu ukianza kutapika minyoo na unakunya minyoo.
Health experts call them soil-transmitted helminths. Intestinal worms spread through eggs found in human feces that contaminate soil, especially where sanitation is poor. Children are among the most exposed. They play on contaminated ground, they walk barefoot, and may eat without washing their hands properly. The infection may begin quietly, but its effect can be severe. Poor nutrition, anemia, stunted growth, reduced concentration in school, and in extreme cases, life-threatening complications. Globally, more than 1.5 billion people are infected with soil-transmitted helminths. That is nearly a quarter of the world's population. In Kenya, health officials estimate about 20 million people are at risk of or already infected with intestinal worms. Program data also shows that more than 6 million school-aged children in 27 counties remain at risk. Kakamega County is among the most affected areas. A study among 731 school children in the county found that 44.05% were infected with soil-transmitted helminths, with roundworm being the most common. It is this burden that has pushed the Ministry of Health and partners to take prevention messages beyond hospitals and into schools.
So when you look at the western counties like Bungoma, Kakamega, Vihiga, Trans Nzoia, you will see quite a lot of soil-transmitted helminths. We had prevalences in Bungoma County of high, within some schools of up to 25%, while the set threshold is 10%. And we've been seeing this coming to a reduction, and we are continuing to use this data, to inform evidence and to inform targeted intervention.
At Matete Comprehensive School, the walls have become part of the classroom and a silent teacher. Matete Comprehensive is one of the 24 out of 900 schools in Kakamega County that have benefited with the mural project. For the Ministry of Health, these murals are public health tools designed to keep prevention messages visible every day, even when the health workers are not around.
Kuna wale wadogo ambao hawawezi wakajisomea wenyewe, bali wakiangalia zile picha ama michoro, wanaelewa ni kitu gani yafaa wafanye. Wazazi wakikuja hapa shuleni huwa wanatushukuru sana walimu, maana wanatuelezea kule nyumbani wanafunzi wana insist kuosha mikono yao, usafi wa mwili wao, jinsi vile tunawafunza hapa shuleni. Kuna mabadiliko makubwa hata kule nyumbani.
According to the school, absenteeism linked to sickness has reduced by nearly 25% since the hygiene awareness activities intensified.
Before, you could go to a class and you find that a half of the learners are absent. But right now, as we are speaking, you would find genuine cases of maybe 1 or 2 learners who are absent. The enrollment of the school has risen, and even the performance, because the children are attending the classes throughout.
In Kakamega County, public health officials say neglected tropical diseases can no longer be treated as minor infections.
This year, Kakamega County procured deworming medicines worth 6.3 million. Something which had not been done, and it's not even common among the counties.
The county says it has increased its budgetary allocation for neglected tropical diseases from 1 million shillings to 15 million shillings.
The amount of money that is being allocated the neglected tropical diseases as a program has tremendously increased. I should say exponentially, as we have the reduction in the funding by partners.
When you are aware at the household, then you know how to prevent, you know how to, address it. When the healthcare worker is aware, they will know how to diagnose. If we are aware of what it really means as a government, we will put in resources.
For Christine Khalai, the lesson came painfully late after surgery, stigma, and the sale of family property.
Kionangi alama inanikumbushanga nyuma. Na hiyo lama inanifanyanga mpaka hata mtoto akilia tumbo. Nampeleka hosi na nijiulize amemaliza tangu nifanyie deworming. Amemaliza miezi ngapi?
Help stop the spread of diseases.
Simon's scar remains, but for the pupils reading these walls, the hope is that the lesson comes early enough to prevent another child from reaching the operating table. Wash hands properly, use toilet, wear shoes, seek treatment early. Violet Auma, KTN.